I'm Jackie Walters and I'm the Programme Manager for Slough Pilot, which is Steps to the Future. The one I'd like to mention is group consultations, and this is where we have introduced training for practices, GPs and their staff to consult with up to 12 patients at a time who have a similar problem. These patients would agree to come into group consultations, and the GP can talk to the patients and consult with them where they have common problems. And so they develop a group where the patients feel supported because there are other people around who have similar problems, but also the GPs can consult with more people than they would be able to in a one-to-one setting, reduce the time that GPs need and so free up their time, and it also helps the patients to understand their condition better and to be able to care for themselves with support of others. I think the most important thing is that we began the whole process by listening to our patients and what they told us and what they felt was important to them, and then we followed that through and worked with our patients and the clinicians to design a programme that would respond to those needs. The benefit, I think, is that people will be able to see that ideas that they've come up with and suggestions and thoughts, that insights that they've given us have been taken on board and that they've been turned into something tangible that they can now see taking place in general practice, and it may be in their own general practice. And also the benefit will be that patients can be better informed about their condition, that they can receive support from other patients as they develop support groups going forward from group consultations, and that the understanding that people come away from a consultation with is much clearer and helps them to keep well. I think the main advice would be to ensure that you have some lead clinicians involved, that you have people who really believe in this and want to try something different and believe in the change that's taking place, and for them to work with patients to design the best way to provide the service so it is owned by both patients and clinicians.